So I have a very different video for you today. It's about moisture chambers. So 6 months ago, my life drastically changed. I got a really terrible pain in my eye, and cutting a very long story short, I ended up at the wonderful Moorfields Eye Hospital in London, and I got diagnosed with several eye conditions. So blepharitis, meibomian gland dysfunction, where the glands across my lashes get blocked, dry eye syndrome, and allergic conjunctivitis. And I've been really suffering, and it's been a really difficult time. But something that one of the doctors recommended to me at Moorfields was to use something called moisture chambers at night for my eyes, because they were drying out so much. I had some erosions on my cornea, which is the clear covering to your eye. And he told me that there are lots of gadgets that you can buy. It's like special goggles that you wear at night that push right into your eyes and create like an airtight seal so the moisture can't escape. But he said to me that they don't always work, because when you sleep you can knock them off and things. And he said that it happened to be a research interest of his, but that the best thing that they know to work so far from trying to stop moisture escaping from your eyes and your eyes drying out at night is using cling film and surgical tape. And to be honest, I'm only 4'10", I'm very tiny, I have a very tiny face, and I probably wouldn't be able to get the goggles to fit me. And even if I did, I suffer from something called cluster headache syndrome, which causes very, very bad pain here, and so I couldn't cope with anything pushing right into me. So I went away and I thought about this moisture chamber idea, and I thought, great. So I thought, I'm just going to Google it, moisture chambers, and I'll find out how to do it. Nothing. There was nothing on the internet about how to make your moisture chambers and how to apply them. So I thought, do you know what? Somebody needs to teach people how to do this. Now, I am not a doctor, I'm not an optician, I'm not an ophthalmologist or an eye specialist. I'm a makeup artist and I'm a cognitive behavioural therapist. Both wonderful jobs, both have nothing to do with the eyes. So I'm just an ordinary person, and I'm just going to share with you what I've learnt over the past 6 months, and I hope that this will help you in some way and make your eye journey that little bit easier. So what will you need for your moisture chambers? Cling film, okay? A nice big roll of cling film. 2 pairs of scissors. It's really important you have 2 pairs, you'll find out later why. Micropore or surgical tape. Don't even think about using sticky tape or any nasty things like that or sellotape. It's really important, it must be surgical tape. Post-it notes, or any type of sticky note. A felt tip or a marker pen, a hairband, and some mattifying cream. The first thing you need to do is make sure that your face is clean, and you need to tie your hair back as well, so make sure your face is freshly washed. And then, if you're prone to oily skin or greasiness, it's really important that you use something that's going to soak up the oil. Never put anything near your eyes, but around here, if your face tends to get greasy, when you put the moisture chambers on, throughout the night the oil is going to make the tape separate from your skin. So the one that I use is it's Paula's Choice Skin Balancing Daily Mattifying Lotion, and it's great. So what's great is this next step you only need to do once. So get your post-it notes. It's lovely, it's got this lovely tacky bit here. It's better to use a felt tip pen, but I couldn't find one this morning. What you want to do is you want to shut your eye and very gently hold your post-it note over your eye. And then what you want to do is draw round. You can feel this, like your orbital bone, I think it's called. Can you feel that? And you want to just, it roughly, it doesn't matter, just roughly, just draw a rough shape, like that. Can you see that? And you're better to go bigger than smaller. And then what you want to do is you want to get pair of scissors number 1. You want to name one pair of scissors your sticky scissors and the other pair of scissors your dry scissors. So get your pair of scissors that are going to be your sticky scissors. And then get your post-it note and cut round. And make sure you do a separate one for each eye, because you might find that the shape is slightly different. There we go. And then write on it, and write left. And then on the right one, write right. Okay, so now we've got a template. Excellent. Get your cling film. And what you want to do is you want to get a nice big sheet like this. Keep it taut and then fold it in half, because cling film is thin. So then you folded it in half and you've got a double layer. Can you see that? Then you get your template, and because it's a post-it note, it's got the tacky bit on the back, and then stick it to your cling film like this. And then what you're going to do is with your dry scissors, okay, your cling film scissors, not the ones that you've used to cut out something sticky, cut round the template. Keep the cling film taut and then cut round it. So now what you're left with is you've got your template on your cling film, okay? Peel it away gently. Now we have a beautiful moisture chamber. So, next thing, grab your micropore. Here we go. Now, I've found that it's best to unroll maybe that much. Leave it on, don't cut it off. Then with your sticky pair, okay, you want to keep it on the roll and then you want to cut it in half. I'm just going to do a little bit for you. So can you see I've got cut in half, okay? Then what you want to do is, it just makes it easier, is then you can cut off little sections. You see that? And then put them on the edge of your dressing table or your bathroom cabinet. Now I really recommend that you cut out your moisture chambers way before you go to bed, okay? And you cut your tape before you go to bed, because what will happen is if you leave it before you want to go to sleep, you're going to be really tired. And sometimes you think, I'm too tired to do this, I can't be bothered. And then you're not going to use the moisture chambers and it defeats the whole object of the routine. So what I tend to do is I tend to do mine about 7:30. I just go upstairs to myself, I cut out my moisture chambers and I prepare my tape and I leave them on my dressing table. So okay, so you've got your moisture chamber now. Let's pretend you've got all your tape cut out. What do you do next? So the last thing I do is I put my eye drops in, one of the many, and I wait a little bit so there's nothing running down my face or anything. So I've got some fresh moisture in there. And then what I do, take your moisture chamber, okay, you place it over your eye, like this. And what you want to do is you can press it on, but you don't want it to be really tight. So you want a bit of, you've got a bit of room there, because you don't want it pressing on your eyelid at night. And then you'll find it naturally sticks to your skin, which is great, and just leave it there. And then what you want to do is you just start placing the surgical tape over the top, okay, like this, and press really hard. It's really important, and overlap the tape and keep pressing really hard, because what you want to do is you want to make sure that there aren't any gaps at all between the cling film and the tape, and you just keep going, okay. And what's great is because it's cling film, you can keep changing the shape. So say that I thought, well, that's sticking out a bit there. So it's down here. Let's say, for example, down here it's going a bit low. I don't need it to go that low. So I'm just gonna tuck that under. Can you see? So I folded it under like that. And then I'm just gonna keep going. And just keep going until I've got a bit of hair attached to that tape. I wouldn't normally use this, but I don't want to keep stalling the video. And just keep going, okay, until you have completely secured your moisture chamber to your face. I tell my husband that I have changed into a superhero, and this is my superhero costume, and that I am cling film girl. Okay, so spot the mistake. So on purpose, can we see that there's a bit of gapping possibly going on there? So you just get another bit of tape and press it on. Okay, so this looks pretty good to me. Just go round and press it all. Make sure that there aren't any gaps. And look, can you see I've got a little bit of pull there, so I can open my eye and shut my eye. Okay, we're ready to go, and then you want to do the other side, and then you're good to go, and you're good to go to sleep. Now, I can't promise that this will work every night and that you won't get a gap in the night. I do sometimes, and if I go to the loo in the middle of the night, I can feel it, and I'll just take myself up again. But it really, really helps. It really helps. Now, unfortunately, I have a lot of medical problems, and I can't always do this because even though micropore is really safe and hardly anybody reacts to it, unfortunately I get eczema, and so I can't always keep this up. But what's really important is, how do you take this off in the morning, okay? Pulling it gently. Yeah, be gentle. But you have to be really gentle, and if you've got really sensitive skin like me, the best way I found is get a flannel, soak it in water, and then press it all around your eye. And it does take a bit of time, and really soak that tape. Soak that tape. So then what happens is it just peels away really slowly. Okay. And it will probably peel away as slowly as this. Now don't forget, this is peeling away slowly because I've only just put it on. But this is so good. I only got married a few months ago, and I did this on the night before my wedding. It's so good that even the night before my wedding I wanted to use this technique. So there we go. I hope I've covered everything. Make sure you use 2 pairs of scissors, because every time you cut the tape you're going to make your scissors sticky, and if you then use those same scissors to cut the cling film, your scissors are going to stick to the cling film and it gets in a mess. I hope this has been helpful. Please comment below. Do you have any questions? Would you like to hear about my life as a makeup artist, no longer being able to wear eye makeup? It's really tough. Would you like to hear about how it's affected my work as a cognitive behavioural therapist? That's been tough. I actually had to give up one of my clinics because I just can't work in air conditioning. Please share this video. Even if it only helps one person, it's worth it. And if anyone from Moorfields is watching this, then I don't think words can describe how grateful I am, and I can feel myself getting a bit upset now, but every single person at Moorfields Eye Hospital has been so kind and so wonderful and so supportive, and I thank you from the bottom of my heart. So good luck with your blepharitis or dry eye journey, or for whatever reason you need to wear moisture chambers for. I wish you all the luck in the world, and I hope you have a lovely day or evening, and whatever you're doing. So take care for now. Bye bye.